I know you don't want to hear that, people. We're all addicted to our cell phones, me included. A huge source of neck pain is our cell phones. Hi everyone, Dr. David Kulla here with Synergy Wellness in New York. A lot of people suffer from a lot of tension across the shoulders and upper back in between the shoulder blades and then creating neck pain, and it's related to your neck pain, and your neck pain is related to your upper back pain. So I'm going to show you a great way to alleviate trigger points, and you're going to see here on her that she has some marks here. These are from some cupping sessions. You had some other cups done here, huh? Someone else did that? Yeah. Okay. An acupuncturist or?
Yeah, I did it myself.
You did it yourself? Okay. Yeah, and you can do cupping yourself. I've done a bunch of videos on that and how to cup yourself. Did you watch my video? Is that what got you?
No.
You have a cupping set at home?
Yes.
Okay, great. So she has a cupping set at home. If you get the cupping set at home, it has a tube, and you attach the tube. Is that what you have? Mm-hmm. Yeah, and then you attach the tube to the cup. You're able to put the cup on your back and then reach it from the front. So that's a really great way. Cupping is effective. It's a decompressive modality or myofascial modality. What I'm gonna do is laser, okay, cold laser therapy. And this takes about 60 seconds per spot. So what we're gonna do is we're gonna number from 1 to 5 her trigger points on how painful they are. So a 5 would be really painful, and a 1 would be, or a 0 would be no pain. So tell me on 1 to 5 scale how bad this is, 5 being the worst.
2.
A 2? Okay. We wanna get the 3 or up or higher. And that?
2.
2?
That's a 3.
That's a 3, okay. And there?
Say like a 3.
3. And there?
3.
A 3, okay. So we're gonna go ahead and we're gonna do about 60 seconds. This is a 50-watt laser. We're using 1,000 hertz, and that's more on the surface for the nerve endings, trigger points, pain relief, reducing inflammation. That's what 1,000 hertz focuses on, inhibition of the nerves. And when you have neck pain, all your nerves are firing off, and that's why you have all that tension and irritation, and sometimes it gives people headaches, or it just makes people irritable. When you have neck pain, you don't feel good. Everybody has suffered from neck pain, me included. I have every disc in my neck herniated, and I treat my neck with cold laser therapy and chiropractic care. So we're gonna check this same spot and see if it's reduced from a 3 on a pain level scale. Okay, and how's that? Is it a 3, 2, 1, 0?
I'll say 2.
2? Okay, so in 60 seconds it went down 1 notch. We're gonna go ahead, and she had another trigger point right in front of it. So we're gonna go ahead and treat that for 60 seconds. She has a lot of neck pain and stiffness that we've been trying to get under control. Now, I will say this, a huge source of neck pain is our cell phones. I know you don't want to hear that, people. We're all addicted to our cell phones, me included. I'm on my phone way too much. Although when I'm here at work, I'm never on it. But as soon as I get out of work, I am on that phone. It's like an appendage, you know. It's hard, I get it. Everything is there, everything. Our lives are right there in that little great gadget. I mean, cell phones are amazing, but that's what's causing this epidemic of neck pain and stiffness, and it's what's causing hers. I can't tell her to get off the cell phone. I can't make her get off of it. I'm not around enough. But I will say this, instead of looking at it down, put your elbows in your ribs in the front and look at it up here versus down here. Look at my head tilt here while I'm on my phone versus here. It may look weird, but this head tilt makes a big difference. And you could see this poster here on this wall. You probably can't read it, but for every inch your head is forward, that adds 10 pounds of weight. So when I'm like this is like 3 inches forward. So now my head, instead of weighing 10 to 15 pounds, it now weighs 45 to 55 pounds, okay? You don't want that kind of weight on these muscles back here. It's not meant to take that, okay? And I think we went a little past 60 seconds, and we'll go back over this trigger point that went down from a 3 to a 2 on a pain level in 60 seconds. Pretty impressive, but not impressive enough for me. I'm going back over that point. We're gonna do another 30 seconds. Okay, now, how tender is that on a scale of 1 to 5?
I'll say 2.
2, okay. I might even be pressing a little bit harder this time. Am I pressing harder this time? I was, okay. So 2, so maybe it is a 1, I'm pressing a little bit harder, but how about that? That's about how hard I was pressing before. And what's that at?
I'd say 2.
2, okay. So it went down from a 3 to a 2. Obviously you want to do a couple of laser treatments in a row. We're going to go ahead and check her other side of her neck and see if we have any 4 or 5s here. So how about there? 1 to 5?
3.
A 3?
Yeah.
Okay. And now some of these points I'm going over, got to remember, she's got cupping marks there. So she just had a cupping session done yesterday or the day before. So there's some swelling there. There's going to be some tenderness there. So that 3 trigger point there, one of them there I just did over the cupping spot, it's probably a lot less than that. So it's probably not one of our main trigger points. It's a little bit higher, the pain level, because we just did cupping in that area. So it's going to be a little sore in that area. That's normal. And how about this point? 1 to 5 scale?
It's like a 4.
A 4, okay, so that's a bad spot there. And there?
I'd say like a 4.
A 4 also, okay. So we're gonna go out further on this shoulder. Okay, now, how's that now? On a 1 to 5 scale?
It's like a 3.
3? Okay, so that didn't change, and that's right over her spot where she had cupping done. So when you have an area where there's been cupping done, it's gonna be a little more sore. That's not really a main trigger point for her. Now, I'm on a spot where there was no cupping done, and she's got a trigger point of a 4 on a scale of 1 to 5. So that's pretty high, obviously. So this is a big one we wanna check afterwards and see, and we want that to lower to 3 or 2 or less if possible in 60 seconds. So we'll check that here in just a second. So again, we were talking about the shoulders and how being on the cell phone excessively creates a lot of added tension to these muscles, which then creates neck pain and headaches, tension headaches. So the source being computers and our cell phones. So fix your ergonomics, raise the monitor up on your computer. If you're on a laptop, get a separate keyboard and mouse, and then raise your laptop up higher so the monitor is at eye level when you're seated. When you're standing, it should also be at eye level if you have a stand-up desk. Your cell phone should be somewhat close to eye level. So by putting your elbow here in your side, in the front of you, you're gonna get it close to eye level versus this, which is not eye level. That's 2 to 3 inches forward, adding 20 to 30 pounds to these muscles here. They're not meant to take that. No wonder you have stiff neck and why you have tension across your neck. It's because you're on the phone all the time. So folks, get off your phones. You hear that? Mm-hmm. I'll tell you what I've done that has worked. I've just shut my phone off, literally power it off. Because then I have my watch, which is going off, telling me I got all sorts of messages. It's like I'm too connected, right? And when my phone is shut off, my watch, it's Wi-Fi, so it doesn't really, I don't get the messages the same way. So that's one way. And the other way is to put it in a drawer and lock it and just avoid going in that drawer. You really don't need the phone as much as you think you do. How's that? 1 to 5 scale?
I'd say a 3.
A 3. So it went down from a 4 to a 3 there. Let's go back over that spot a little bit more. We're gonna do another 30 to 45 seconds. And you definitely don't wanna do cupping over areas that have already been cupped, especially if they're fresh marks, you know, so cupping leaves that hickey mark. It's a bruise. And you don't wanna put a cup over that same spot again. You can do cupping again and go around it, but don't do that spot. That bruising area should calm down, should go away before you do another cupping session. So for those of you that have had cupping and are wondering how often you can do it daily. Just make sure they don't go over the same spot daily because it takes a few days for that bruising to go away. Okay, let's check. How's it now? 1 to 5 scale.
Just a little less, like 2, yeah.
A 2? Okay, so we did another 30 seconds and it went down from a 4 to a 2, okay? Now this one was also a 4. This is the last trigger point here on her right shoulder. And I use this not only for trigger points, but muscle tension, muscle spasms. This lasers are used for so many different things, and even disc herniations. I have every disc in my neck herniated. This is what I use to rehab it, along with chiropractic care. We're gonna do it for a minute, see how you do, and then if we need to, an extra 30 seconds. And all it is laser light, actual light therapy, right? We're able to program the different spectrums of light, okay, to sort of simplify it a little bit. And certain frequencies penetrate different levels of the tissue, Right now we're just doing the surface, but over several treatments, we go deeper and deeper with the laser, and it has much more of a therapeutic benefit over time. Okay, and how's that on a scale of 1 to 5?
I'd say a 3.
A 3. Okay, let's go another 30 seconds over that spot. Do you have any numbness or tingling in your hands anymore?
Not lately.
No. Okay. Okay, now, how's that?
I'd say 2.
A 2. So again, this spot, we did another 30 seconds and went from a 4 pain level to a 2. So it cut in half, her pain cut in half just in 90 seconds. So go ahead and turn over on your back. Thanks for tuning in, folks. If you have any questions about cold laser therapy or neck pain, comment below. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.